Hey guys, I'm Dr. Ryan McFarland here, one of the family docs at Hudson Physicians. Coming to talk to you guys today about kind of stress and how it relates to headaches and treatment options and things to look for. So again, I'm one of the family docs here over at Hudson Physicians, and with stress, there is a lot involved with that. A lot of people get headaches related to that. Most common type of headaches would be more of a tension type headache. You can also get migraines and quite a few other types of headaches as well. So with these headaches, they can present in a lot of different manners. Sometimes it's just a kind of where people feel a tight band around their head. Sometimes it can be a pressure on one side. When it becomes more of a migraine headache, those typically we think of are more severe. They can present with light sensitivity. They can also present with other neurologic changes as well. But that's some of the things that we can see with stress and headaches. Now, with these, some of the things I wanted to talk about today are treatment options for patients, both here in the clinic and then also out in the community with some of the other providers you're going to hear from as well with this summit. And with tension headaches specifically, oftentimes you will see muscle tightness, maybe some trigger point pain. That's areas where you can press and it's very painful and may even provoke some of your headache symptoms. When you have those, treatment options there range from massage therapy, acupuncture, chiropractic care, and even trigger point injections. Trigger point injections can be very beneficial for people who have a very acute or severe pain where it's affecting their ability to function. And that's something we can do in the office, usually with a little bit of numbing medicine and a steroid into that painful area, which can release it. And have pretty good response to that. 70-80% people will leave feeling an immediate relief from that and often lasting relief from that type of release. And again, it's for a very specific subset, but it is an option for people. And then if it's not a trigger point, but more of just an overall tightness in an area, so part of the pulling muscles into the back of the head can cause both tension and migraine headaches. Stress, sitting at your computer, all of that can cause that. And like the other type of headaches, massage therapy, chiropractic care can help. Medications can help this as well. Medications like muscle relaxers are an option, so you can talk to your physician about that. All right, so then with the muscle relaxers for those tight muscles can help certainly with the headaches. Also associated with stress, our body's completely connected from our brain all the way throughout, so it's not just an isolated muscle issue all the time, or sometimes it's not just a headache. That's where further care with psychiatry, psychology can really help. There's cognitive behavioral therapy that they offer that can really help with those type of headaches. They can help limit how frequent people get the headaches. They can also treat the headaches and help them to go away when they start. And that's a really an underutilized resource in the community. Some of it is because of availability, but some of it is because people aren't aware that may be something they benefit from. You should be hearing from some of those options as well through the summit. When people get migraine headaches from stress, those are a little bit more severe. All of the same treatment modalities we've covered so far help as well. But then when people are getting frequent daily headaches or migraine headaches, sometimes preventative medications are needed. There's a whole host and variety of medications available depending on the type of headaches, your medical conditions, something you can schedule with your physician to talk about and see if that's something that may benefit you as well. Now, with headaches, it's a lot of people ask kind of when should you go see the doctor or when should I be concerned? Some of what we'd call the red flags would be if you have a sudden onset worst headache of your life, we would recommend you get seen immediately. If you're having severe migraine headaches that are changing, all of a sudden it's different than it's ever been, you'd want to get checked out again. Or if you're having what we'd call neurologic symptoms. So that would be numbness, tingling, weakness, vision changes, things like that. That's where you'd want to be seen immediately. Otherwise, some other things you could do at home for treatment, depending on your medical conditions, always recommend check with your providers first, but ice and heat can help relax muscles. Ibuprofen and Tylenol can help. One thing to know with using over-the-counter medications, especially if you're getting frequent headaches, is medications like ibuprofen. You can get something called a rebound headache. So people who take ibuprofen frequently, or medications like ibuprofen frequently for headaches, is when they try to stop the medication, you can actually have a rebound headache. So that's something that I like to caution patients on when they're using the over-the-counter medications, is make sure we're not overusing them. Or if it is finding something you're needing to take a medication daily for, I would strongly recommend you get seen by a provider. That's kind of a broad overview of stress and headaches. It's a large project to cover, and as you'll see with the summit, there are a lot of different specialties and practices that can help people with headaches, and the reason there's so many different approaches is it's not a one-size-fits-all, and it is something that either with your primary care doctor or whichever provider you have a close relationship with is who you're going to work with to find out what is the underlying cause to your headaches and try to address that. And then if you have other unique medical needs, navigating that area to try to help manage your headaches, lessen the frequency and lessen the severity. If you guys ever have any questions, I'm happy to see anyone for a consultation here at Hudson Physicians. I also have many excellent partners in our clinic who help manage headaches as well. And please reach out if you have any concerns. Thank you.